Welcome to Unit 4 about immune disorders. Today we cover Chapter 21, Coordinating Care for Patients with Multidrug-Resistant Organism Infection Disorders, a summary outline, and how the chapter plays out.
Research chapters are about 50 pages long, and half of the time you can't tell what is important. This video will help you to see it all fast. If you are a nursing student, this could save you hours of rereading. And if you are here just to better understand the conditions, I hope this makes the topic feels less intimidating. Hi friends, and welcome back to my channel. I am Nurse Mia, and this is part 2 from the Med-Surg RN chapter, the outline from the GetZen RN study group series. Before we get into the details, I always like to zoom out first to look at the big picture of the chapter. I use a concept map like these to break it down heavy chapters so you can see the full path of disorders, lab intervention, all at a glance. You'll know exactly where to zoom in and what to prioritize. It takes the pressure off and makes the chapter easier to follow. Comment below which section of this chapter feels the most overwhelming for you. The goal? One page of clarity you can revisit in minutes. A map turns 60 pages in 10 minutes of review. Clean path, less noise. You will know where to start and what to skip. Let's get started.
Welcome to Chapter 21. In this chapter, we talk about infection disease that have been plaguing the world for centuries. They are caused by the pathogen microorganisms that are capable of causing disease. For a pathogen to cause a disease, a susceptible host and a mode of transmission are required. A susceptible host usually has a weakened immune system or has had a breaking down in the body defense mechanism. For infection to be transmitted, transport mechanism is required. So a route of transmission are contact, airborne, vehicle, and vector-borne. Contact transmission occurs when a person or an object comes in contact with a pathogen. Airborne transmission occurs when pathogens are carried through the air. Vehicle transmission is an indirect mode of transmission that occurs when a disease-carrying agent touches a person's body or is ingested. So similarly, a vector-borne transmission is also an indirect mode of transmission that occurs when a vector, an organism that transmits a pathogen's bites or insects a person. So the epidemiology, we talk a little bit about MDROs, which is the multi-drug-resistant organism. We have in this chapter like 1 and 2, and then we talk about MRSA and all of them, and then more in this area we talk, and then some nursing management and a little summary. So the introduction, I just said it's contact, airborne, vehicle, vector, with just a review from the key terms. So now we're moving forward. So I was saying that this chapter 21, now we are in the introduction. The second has the multi-drug-resistant organism, which is MRSA, VRE, C. diff. I call it AB this, and then CRE, and then the third is the interprofessional management of drug-resistant organisms. And here is the nursing in here. So now I'm going to show you my little map in my light. It's right here, but I'm going to zoom in. So we are here on my little map, concept map, the outline of the chapter. As you see, introduction, multi-drug resistant organism. Here there are all 5, and each of them they have epi, patho, some tables, and clinical management, complication, and I'm gonna talk little bit, few words of each of them, little bit, and then in here on the third part we have the medical management, like diagnostics, treatments, and other little thing. And here we have the nursing, about teaching, action, assessment, and the chapter summary. That's the agenda for today. As you see now, since we are in drug resistant, this section has 5 subcategories. So I call it as A, B, C, D, E. So each 5. So we can go along on this area. So we know the MRS, read, C. diff, AB, I call it, and CRE. So A, MRSA, so methicillin resistant Staphylococcus aureus. So the risk factor is recent hospitalization, invasive procedures, immunosuppression, pathophysiology, resistance on beta-lactam antibiotic. May see here, methicillin, oxacillin. Clinical manifestation, skin infection, pneumonia, bloodstream infections. Complications goes to sepsis, necrotizing, pneumonia, osteomyelitis. So a little bit about epidemiology. MRSA is a common healthcare associated infection, especially in surgical and ICU patients. It spreads via direct contact and contaminated surfaces. Patho, it is caused by Staphylococcus aureus that has developed resistance to methicillin and other beta-lactam antibiotics. It is produce toxin and enzyme that cause tissue destruction. Clinical manifestation, MRSA infections may present as skin and soft tissue infection, pneumonia or blood infection. Lesions may be red, swollen, and purulent. So MRSA really looks like a bigger step than just a staph infection. And as we know, staph likes blood wet and nice and warm. Untreated or resistant infection may lead to sepsis, organ failure, and death, especially in immunocompromised patients. Vancomycin resistant enterococci. So the risk factor is prolonged antibiotic use, hospitalization, and center catheter use. Then patho, alteration in the cell wall, target site preventing vaccine binding, and then clinical manifestation, UTI, wound infection, bacteremia. So we know that on the AP, this strength is often found in patients with long hospital stay, especially those on prolonged antibiotic therapy. So it's expressed by direct and indirect contact. So if you see here, normally in the GI tract become resistant to vancomycin through the altered binding sites in the cell wall. Those mutations allow the bacteria to serve vancomycin exposure. So we see urinary tract infection, the UTI, wound infection. So with UTI, when the patient has a Foley calf, it's better to have a limited days to use, not a prolong, because we want to avoid this infection. We are on C, C. diff, or Clostridium difficile. The risk factor is antibiotic exposure, especially with clindamycin, prolonged hospitalization. Patho, it's overgrowth of C. difficile due to disruption of normal gut flora. Here you see the clinical manifestation is severe diarrhea and complication toxic and septic. Patient present with watery diarrhea, abdominal cramping and fever. Severe cases can lead to pseudomembranous colitis. Can cause toxic megacolon perforation, sepsis. We are on AB, I call it AB. Risk factor, it's ICU stays, ventilators, prolonged hospitalization. Patho, it causes infection through colonization of wounds, respiratory and urinary tracts. It is resistant to most antibiotic, making treatment very challenging. The complication is multi-organ failure, prolonged hospitalization, and high mortality, and potential outcome. So the mortality is potential outcome. Highly resistant gram-negative bacteria. Clinical manifestation, pneumonia, wound infection. Here, the CRE, the risk factor, recent hospitalization, exposure to carbapenems, invasive devices. So the pathway is resistance to carbapenem antibiotics, clinical manifestation UTIs, pneumonia, bloodstream infection. Complication is highly mortality due to limited treatment options. It's all this. It's because patient get from hospital stay. So managing the multi-drug-resistant organism in healthcare. We need medical management of MDRO infection involves accurate diagnostics, early isolation, and appropriate antimicrobial therapy. Cultures and sensitivity tests guide the selection of effective antibiotics. In many cases, treatment is very complicated by limited antibiotic option due to resistance. So this is requiring the use of combination therapy or last line agents. So we see I make here treatment and medication like a little list. It's a table in the book, and so the diagnostics involves collecting appropriate culture like blood, wound, sputum, urine, and identifying the pathogen and resistance pattern. So the polymerase chain reaction (PCR), enzyme immunoassay like AIA, and the susceptibility tests are very crucial. The treatment includes initiating empiric broad-spectrum antibiotic, following by the de-escalation based on culture result. So the supportive care like fluid management, wound care, and respiratory support, I think it's also needed. For medication, we said the medication list here, vancomycin for MRSA and C. diff, then linezolid for MRSA and VRI, the tigerlicin for the MDR. And there are a long list in the books, but keep in mind the probiotics might be used to support the GI flora during the antibiotic therapy. So a patient will get antibiotic, but also is required on the meal tray to have a probiotic, and also they have like some medication for GI. For nursing management, so the assessment and analysis, we have nursing diagnostics, nursing intervention, teaching patients and the family. So here's the list of diagnostics when you make a care of plan, some intervention that might include, but the nursing management and intervention is strict hand hygiene and contact precaution, environmental cleaning and disinfection, especially for the C. diff. Patient isolation is needed to prevent cross-contamination. Is needed monitoring for sepsis and complication. with teaching patient and family importance of completing antibiotic therapy, proper hand hygiene and infection prevention measure, avoid unnecessary antibiotic use to prevent resistance. For nursing management, its focuses on infection prevention, isolation procedures, monitoring treatment response, and educating patients and families. Nurses are essential in implementing contact precaution, managing symptoms, and preventing further transmission. For assessment, you need to assess for fever, abnormal lab results like the white blood cells, signs of sepsis and antibiotic-related side effects, analyze trends in viral signs, fluid imbalance, and lab markers to evaluate the treatment if it's effective. We are in the summary finally, so we are almost there. So we have to keep in mind that these multi-drug resistant organisms are a major healthcare challenge, leading to increased morbidity and mortality. Common of MDROs include MRSA, VIRS, C. diff, all of here, right? And because they producing bacteria. Transmission occur via contact, airborne vector or vehicle spread. Strict infection control measure like hand hygiene, contact precaution, and environmental disinfection are very crucial. So those infections can progress to sepsis, require early detection and aggressive treatment. The carbapenems are the primary treatment for the ESBL, and resistance is increasing. The sepsis protocol include early fluids, antibiotic, and monitoring for shock progression. Nursing intervention focus on isolation precaution, monitoring for worsening symptoms, and educating patients, preventing those multi-drug resistance organisms. Spread includes limiting the antibiotic misuse and following infection control protocol. So the healthcare workers must remain very vigilant for signs of infection, worsening to sepsis, or much more. Here, the isolation precaution. So you see hand hygiene must, isolation gown must, isolation gown and gloves must, and hand hygiene must. Usually keep in mind that these might be in basic care and comfort. For in NCLEX will tell you the how like a patient it's in contact isolation or airborne isolation, what are the steps, and you have to make the correct steps. So by knowing these and how which one is airborne and contact, it's useful for in the quizzes, in finals, proctors, if you get points there, and NCLEX might be, but for sure like hand hygiene or about isolation might be a question. because it's infection and control, but also it's with basic care and maintenance. Very quick, I want to show you, this is the way that when I make outline, I make like very short bullet points just for me to remind about the septic protocol, early initiate treatment, and severe septic. So for me, it's like like a like a little flashcard. So this is my little flashcard. Yeah, infection progression from local infection to septics, like the viral signs, sepsis, and then severe and septic shock. This also it's very common with NCLEX. So now I'm just saying to you my last thanks. I'm checking out, so I resume here.
Thank you so much for being here with me today. I hope this video helped make things feel a little clearer and less overwhelming. If this supported your learning, please give it a like or share it with your fellow nursing student who might need this too. Everything we cover connects back to the real nursing, wherever it's recognizing a lab, planning safe care, or knowing what to teach a patient. Let me know in the comments below, what was the most helpful thing you learned today? What still feels unclear or confusing? If this was what you hoped, and make it easy for you. If you can also let me know if you like the notes for this chapter. Check the description. I usually add some free resources there just for you. Thank you again for your time and trust. I'm Nurse Mia, and from my heart to yours, until next time, stay zen, stay grounded. Namaste. Bye for now.